cabinet, which is, of course, one of the things that happens in politics. But could we just get into the discussion right away? And may I ask, Shailaja ma'am, what was it about Kerala that was able to fight both Nipa and COVID quite successfully, apart from the fact that the common factor was you?
Yes, you want to explain that thing?
Yes.
Okay. I think we have a comparatively better public health system here. And as soon as we arranged a teamwork for fighting against Nipa and COVID-19 pandemic. Nipa was the first time in Kerala, and we didn't know at that time what is the no medicine and no vaccination. We all know about that. But at once we acted. We are to fight against this deadly virus, and at once we set a protocol and a standard operating procedure to fight Nipah. The one thing we implemented is to contain this virus in that short space. We didn't allow people to move outside. Actually, when the cases were reported, the people were at once started leaving that place in fear, and we rushed there. Personally, I went there and I appealed the people, don't move outside. We will provide everything to you, food, medicine, anything you want. And that way we contain the virus in that place itself. And to cut short this spread. And isolation, screening, etc. I think we win in that battle. We won in that battle. We have some experience on Nipah incident.
Right.
And when I was the minister, when I heard about some potential virus is spreading in Wuhan, China, at once it clicked in my mind because there is a medical university in Wuhan, and I remember that some students came to me previously to have the registration and also for internship, etc. And at once I called my health secretary and discussed with him. I think Rajan, I suspect that someone will come from this Wuhan to Kerala and they will take the virus to Kerala. He said it is correct. It is the period of some kind of celebrations, and people will get leave at that time, and definitely the students will rush to Kerala. And for that fear, we started our precautions. In anticipation, we started training and mock drill, and also we started the control room, etc. And we trained 18 expert groups. People laughed at us that it will not come here. What are you doing? You are overacting. People suggested, people commented like that. But we didn't hear that thing, and I'm sure that it will come to Kerala. And because of that early preparation, we got the first cases. When the flight came from Wuhan to Kerala, there in the airport, there was our screening team, experienced or trained team there, and we got the 3 cases at once and we isolated them. And that way we proceed. But the people from other countries, when they started coming, some cases we missed and they went to the society. Yeah. But at once we realized it, we rushed there and we traced their contacts and we acted like that. The sudden action, I think, and the team formation, the training and the collection of the materials, protective equipments, that things saved us. That is the method of the activities at that time.
Right. Dr. Shetty, may I bring you in? Because since we've seen what's happened in Ukraine, I've seen your old video going viral everywhere about, you talking about the state of medical education and exactly what we need. And you've been a very strong proponent of the fact that we do need more doctors, we do need more nurses. But I want to bring in the point that Shailaja ma'am has made about the public health system as a whole. It's not just doctors and nurses, it's also the rural health workers, it's also the leadership at the top. I mean, there's a whole system that is created around the doctors and the nurses. So, talk about what exactly have the lessons from COVID been, and how do we make sure that going forward the medical education system is able to sort of foresee something like this?
First of all, we need a lot more doctors
Yeah.
than what we have. I'll tell you, ask you a question. My observation is that nobody knows how many doctors we have currently in India.
Right.
No one can say that we have 8 lakh doctors or 12 lakh doctors.
We don't have
And
any figure.
Nobody has a figure.
Right.
On and off in the various government discussions, the figures are projected. I have gone through those figures around 10 years ago. 10 years ago, there were doctors who were registered in 1935 in the registry. Okay, so nobody knows. If you really want to plan how many doctors we need,
Right.
we need to know how many doctors are actually practicing, not how many doctors are registered. No doctor, when they retire or they die, they remove their name from the registry.
Right.
Yeah, nobody cares.
Right.
So essentially, we need to know the number. But in our practical experience, you drive 20 kilometers away from city of Bangalore, you will find there are not that many doctors. Forget about the private hospital. Even in government hospital, there aren't that many required number of doctors. That is the first thing. Second thing is, COVID has proven that the most important people in a critical situation are not the doctors.
Yeah.
It is the nurses.
Nurses, exactly.
Yeah. Nursing, there is an acute shortage of nurses across the country. You go through our registry of you go to any private hospital, ask them what is the attrition rate. It is nearly 40% to 50%. That is the kind of a turnover we have, because the girls get educated, they become nurses, they work in a hospital for 1 or 2 years, then they go to Middle East or go to overseas countries or do something. So essentially, there is a huge shortage of nurses. Now, why there is a shortage? Because the most influential, I am advising so many governments, but I cannot start a nursing college. It is impossible for anyone to start a nursing college in this country.
Why is that?
Because no government gives the permission for you to start the nursing college.
No.
Yes.
Okay.
On one end, we are talking about shortage. On the other end, we do not allow new nursing colleges to come up. When you ask the policymakers why we are not able to start a nursing college, the answer is there are too many nursing colleges.
Right.
When you actually go to the data, that many nursing colleges are issued the license, but very few of them are working. Right? These nursing colleges were started in shopping malls and all over the place without any affiliation to the hospital. So obviously those nursing colleges are closed, but new nursing colleges are not given the license. Okay. So essentially, we are talking about all the crisis situation, and it is all about manpower. And we are doing very little to address the issue.
Right.
Unless we have the data. If anyone talks about, oh, we have too many, what is too many? How many nurses are practicing in India? Nobody knows.
The doctors were practicing privately, but nurses were wandering to get a job. They were in the PSC list, but we cannot provide job for all of them. And we have an online advertisement to register in that COVID brigade. And so many nurses, even doctors, registered in that COVID brigade. Doctors also are there in need of job in government sector, and they are waiting. And in our PSC list, there is a long list, and only few is getting this job through PSC list. And we recruited them. And as the doctor said, Dr. Devi Shetty is a very experienced Dr. G said about the actual number. What is the number of actual trained doctors or nurses in our country? I don't know. But the 15th Finance Commission now released a statement as statistics about the nurses and doctors. They are commenting that there is a chronic shortage of health professionals in India. We should have to add 10 lakhs doctors at once to get in par with the world average. We should have to appoint. They are saying the 15th Finance Commission is saying we should have to appoint 30,000 doctors per year to achieve the aim or the world average statistics. And we have the world average, world norms is 1,000 people. For 1,000 people, there should be one doctor.
One doctor. That's
And
right.
one doctor. But in India, the statistics shows that it is 1,511. But I don't know whether the statistics is right or not. Dr. G correctly commented on that point, that whether they were working in the system, they were taking this numerics from the registration the data. But after registering here, they are going outside or they are going anywhere. And we cannot say that they are working for the population in India. And the statistics may not be correct. And but even in the statistics, we have in India, we have only 1,500 doctors, people, one doctor. That is not sufficient.
Right.
And WHO norm for nurses is 1:300. But in India, the nurses patient ratio is 1:670. That is in the actual period, normal period. But if a pandemic or any infectious disease occur, it becomes drastic and it becomes very difficult to tackle with this problem. That is the condition in India. And even in Kerala, comparatively a very good position is there in Kerala. Earlier I stated that we have very good public health system, but the patient-doctor ratio, patient-nurse ratio, that is not sufficient. When I was the minister, I started from 2016, when I examined all the things were in the 2016 when I examined, it is 1961, according to the 1961 pattern, the patient-doctor, patient-nurse ratio. And I quarreled with the finance minister, or I compared, and the chief minister was very helpful, and finance minister also. They were very helpful, and they created more than 7,000 posts during this year. But that is not sufficient enough. Yet we are suffering by this shortage.
Right.
And we should have to add more doctors and nurses to the system, not only in public system, but also private sector. We should get more health professionals. That is the need in the society.
Right. Dr. Shetty, you've been arguing that the medical education system has become elitist, and it is really the people who have the fire in their bellies are not able to enter medical colleges. It's just too expensive for them. Talk a little bit about this and really how, going forward, we need to make this part of the national agenda.
See, we cannot blame the colleges because the regulations are such that today with less than 500 crore rupees, you cannot build a medical college. Nowhere in the world you need this kind of a money to set up a medical college to train just 100 doctors per year. Now, if the regulation says that you need to have 20 acres of land, you need to have a hospital which is built only for the sake of medical college. Supposing there is a very well-run existing hospital, you cannot make it as part of the medical college. It has to be built for the purpose of medical college. Then you need to have a big air-conditioned auditorium. You need to have a campus with all the hostels for all the doctors, students, everyone. When there are so many low-cost accommodation available just outside the campus, nowhere in the world they have this kind of a regulation, right? So then you force them to spend 500 crore rupees, then you try to reduce the fees. It is not fair. So we need to relook at the entire concept of what a medical college is. Right?
So,
unless
when we,
yeah.
Doctor, when the Prime Minister talks about medical college in every district, is it possible with the current regulatory system?
It is possible, definitely possible. Government can build it. Government can spend 500 crore rupees and then charge a very small fees because they're not looking at a return on investment. But a private sector, and also the minimum cost for maintaining a medical college is about 100 to 140 crore rupees per year. Then if you have 100 students, who has to pay that money?
Right.
So essentially we have created a huge monster, and you have to constantly feed it.
Right.
But there is an option.
What is the option?
Yeah, I'll give you a simple example.
Yeah.
Now there are at least 18,000 students stuck up in Ukraine.
That's right.
And they're all coming back.
But they'll have
Now,
to come
it's
back, take the
yeah.
exam, then they'll be, eligible.
No, they can't take the exam because they are students.
Right,
They haven't
right.
completed
Yeah.
their course. They may be in the first year, second year,
Right.
whatever. Now, those 18,000 kids won't be able to go back because that country, rebuilding that country will take another 3-4 years at least. Okay. Now, you distribute 100 students to each medical college.
Right.
Give them extra students. Let them join first year, second year, third year. The campus we have in medical colleges for preclinical can easily manage 500, 600 students. Today they have only 100, 150 students. So they can easily manage preclinical. For clinicals, you can't send the 100 students to the existing medical college hospitals because they are already crowded with the medical students. Some hospitals have more medical students than the patients.
Right.
You can't send them. So these medical colleges should affiliate with a district or a taluka government hospital,
Right.
which is 250, 300 bed hospital. And the facility there should be upgraded,
Right.
like a medical college hospital.
Right.
And these students should be made to study in that undergo clinical program in those district hospital or a taluka hospital. But you cannot pull the teachers from the existing stream of medical college because then you are going to deprive some other college of the faculty. Because the faculty requirement is very strange and very, very rigid. We need to allow the existing practicing senior doctors of that town to be the faculty members who teach the young students.
Right.
This is how I was trained in government Venlock Hospital. I'm a product of Kasturba Medical College, Manipal and Mangalore. All my teachers were successful doctors of Mangalore city and they were our teachers. Today, any accomplished doctor of the town is not allowed to teach medical students. To teach a medical student, you need to have joined the medical college as an assistant professor, associate professor. Then you become a professor. Then only you can be teaching. So you have to change those regulations. Then the 18,000 students can be trained at a very, very affordable cost for the parents. And it can be done in a remarkably short period of time.
Right. We're, as usual, running out of time. Shailaja ma'am, a piece of advice that you gave to your successor, what did you tell her when she took over? What is the way forward for Kerala's medical health system?
Yes, I have some experiences on this. As Dr. Ji said that we should have to change the regulations and also the policy. I mentioned about the central government because the policy should be changed. I think you know that central government is spending only 1% of the GDP in the health sector.
Right.
And we can say 1.4% including the state government's expenditure. And if we isolate it and the central government's expenditure on health sector is only 1% of the GDP, what can we do? We cannot do anything. We cannot improve the infrastructure. We cannot appoint more human resource or anything, equipments, etc. Every day it is changing. New interventions are coming here. New equipments are coming in health sector, and we should have to add everything to the health system. But we cannot. But in Kerala, luckily we started one thing, that is the Kerala Infrastructure Investment Fund Board, and we got some loans for capital expenditure for the infrastructure development and also for the equipments. It cannot be used for revenue expenditure. We cannot appoint more doctors on these funds.
Right.
But we started improving. The last 5 years was a fantastic change in Kerala. 20 crores to 760 crores and 1,000 crores for the medical colleges. 20 crores for the taluka hospitals and 100 crores for the district hospitals, and we invested. The work started for the Trivandrum Medical College, got 760 crores for the infrastructure development. The thing is that we should have made a master plan to have a master plan. What should be added in the medical colleges and what in district hospitals. I found that in some district hospitals, they have 5 or 6 acres or 2 or 3 acres. There are buildings, small buildings in each and every place, and the navigation, it is too difficult. And it is not a hospital, but small buildings here and there. We should have to change all these things. I am not explain these things. It is too difficult to the function of a hospital out of this. And also central government is saying that each district you can start a medical college.
Yes.
Only 25 acres, The Trivandrum Medical College and Kottayam Medical College, they have more than 300 acres when they started the medical college. Now we are in scarcity of space there. We cannot build. We have to have dental college and quarters and other thing. Very good clinical practice. If we want, there should be very good specialty block, etc. But in 25 acres, how can we start a medical college? I don't know. And also, we are attaching our district hospitals to get one medical college for clinical practices. But poor condition is here. Comparatively, it is better in Kerala, but the district hospital, they have no modular theatres or proper super speciality blocks, etc. And how can we call it a medical college? What will be the fate of the students who come out of such a system? And Dr. Ji said that we should have to include the students who are coming back. It is too difficult in practice. That a very good idea he made in front of. That's very good idea, support that. But in practice, where we can include the students. Now also in all the medical colleges are in scarcity of space and also human resource, etc. They cannot all of a sudden increase the strength, student strength there. That is the problem. And the central government should change their mind. And if I think at least 10% of GDP should be invested in public health system. Investing in public health system means not only improving the health of the individuals, but improving the economic status of the country in future. Right. They are not thinking. We are not thinking so. We are not thinking. Even after the independence, we never thought about this thing, increasing the investment to more than 100%.
Thank you. Dr. Shetty, last word. Wonderful idea, but difficult in practice. What's your response to that?
See, I agree it's not easy, but it can be done because we have to look at a new location for the medical college, clinical work. It has to be a new hospital. They cannot be, and there are many government hospitals in every state. And a private medical college can easily convert a existing government hospital as a medical college hospital, right, and use it for teaching purpose. I was trained in such medical college hospital. It wasn't owned by the Kasturba Medical College. It is a government hospital, but it is a wonderful place to train young doctors.
So I do hope all this is possible. Thank you very much for joining us from your respective cities. Thank you.
Thank you. Thanks.